In the United States, there are about 5,500 surgery centers. There are an equal number of hospitals in the country. At any given time, a third are losing money, another third are breaking even or making just a little bit, and then a third are very successful. The difference quite often is the quality of management.
Several years ago, St. Mary's owned and operated the surgery center, and it was not successful. We had volume, but we were not making money here. Prior leadership decided to partner with physicians and Regent in a way to try to bring greater value to the community through this outpatient access. Regent demonstrated that they had a very good knowledge of how to do this and do it efficiently and in a quality manner, and the doctors have been very pleased.
When Regent Surgical Health took over management of Surgery Center of Reno, new physicians were recruited, insurance contracts renegotiated, and investments were made in new technology. Within 14 months, revenue increased significantly, and the center generated a 110% return on investment.
As physicians, we have very little knowledge overall about the business aspect of a center like this. Regent brings a huge expertise to the table for us, and they really have allowed us to turn the profit we have over the last 3 years.
Regent manages 14 surgery centers and 2 surgical hospitals, promoting their clinical and financial health.
Regent's business philosophy is one of partnership. The original business model was built on 3 strategies. We saw the need for turnarounds, we saw the ability to build some new surgery centers, and finally we saw the opportunity to take successful surgery centers and create a surgical hospital model.
Physician-owned hospitals and ambulatory surgery centers for about the past 20 to 30 years have consistently demonstrated through statistics the better outcomes for patients, lower infection rates, higher patient satisfaction, less injury. The patients are just delighted with the care they receive with excellent clinical outcomes.
Another Regent success story is Calumet Surgery Center in Munster, Indiana. When Regent took over management, it was losing money and needed to attract new doctors and cut costs. Today, it has been converted to a surgical hospital.
They took every contract that was offered to them. They were losing money on every patient. They decided that they needed the efficiency in their inpatient surgeries like they enjoyed in their outpatient surgeries. They needed to control the quality of care to their patients and basically build their brand in the community. We are excited to be entering the hospital arena with a very focused factory concept.
In addition to turnarounds, Regent Surgical Health is helping surgery centers and specialty hospitals grow through the addition of new procedures. Spine surgery is changing from inpatient to outpatient, perfect for the ASC setting. And Regent is developing world-class spine programs across the country that generate high-quality outcomes and profitable programs.
Spine surgery itself is going to grow exponentially here in surgical center setting. In conjunction with Regent, we've developed the Regent Spine Program, and this really allows us to visit other centers that are interested in starting a spine program or adding it to their already established ASC.
Weight loss surgery is a second area of growth in healthcare.
We've seen the development of less and less invasive techniques that really lend themselves to the outpatient environment. Many of these newer techniques allow a person to come in, have the procedure done in usually less than an hour, and be home the same day.
Regent Surgical Health recognizes that quality healthcare is efficient healthcare. As partners, we bring experience and expertise to the turnaround and development of surgery centers and surgical hospitals, creating success for physicians, patients, and communities.